From the New England Journal of Medicine. Bivalidurin started during emergency transport for primary PCI.
Clot, while significantly reducing bleeding and cardiovascular death compared to warfarin. Our study findings represent good news for patients and healthcare providers, said Robert Giuliano, MD, SM, FACC, FAHA, BWH Cardiovascular Division, lead study author. We believe that once-daily edoxaban represents a new, effective, safe and convenient treatment to prevent stroke for many patients with atrial fibrillation, with the benefits of less bleeding and cardiovascular death compared to standard therapy with warfarin.
Introduction. Venous thromboembolias (VTE) is the third most common cardiovascular disease after MI and stroke. Current standard of treatment: heparin vitamin K antagonists (PKA). New oral anticoagulants with and without heparin are effective and safe in the treatment of VTE, and certainly exists about percentage of more severe VTE in previous studies. What is the edoxaban? Oral direct factor XA inhibitor with a rapid onset of action, half-life of 10 to 14 hours. 60 milligrams once daily dose was selected based on the phase second data. Dose of 30 milligrams in case of moderate renal impairment. Low body weight, i.e. less than 60 kilograms. Convenient use of PGP inhibitors.
Dr. Singer of Harvard, and we're going to update the information that he shared with us last year after Boston Atrial Fibrillation Symposium with new information from this year, where he ran a half-day symposium on stroke prevention in atrial fibrillation. So, Dr. Singer, thank you for joining us. And would you share with us some of the things that you talked about at Boston Atrial Symposium this year?
Well, Melanie, this has been a truly momentous year with regard to stroke prevention and atrial fibrillation, particularly as relates to the new anticoagulants. We did talk about the rivaroxaban rocket trial last year.
Era uno degli studi più attesi qui ad Amsterdam in occasione del congresso europeo di cardiologia, l'ESC. Stiamo parlando dello studio OXAI che ha confrontato l'efficacia e la sicurezza dell'edoxaban, un nuovo anticoagulante orale, nei confronti del warfarin in pazienti con tromboembolismo venoso. Ci si è infatti raccontare come è andato lo studio dal professor Henry Bühler dell'Università di Amsterdam, primo autore dello studio. Could you please describe briefly the protocol of the OXAI-VT study?
OXAI-VT compared low molecular weight heparin followed by edoxaban 60 milligram once a day, fixed dose, with low molecular weight heparin followed by vitamin K.
Background OXAI VT study. Randomized double-blind event-driven non-inferiority study designed to broaden applicability to real-world practice by encouraging physicians to enroll all VTE patients, starting with the standard parenteral heparin, at least 3 months treatment duration flexible. All patients followed for 12 months, halving the dose for patients perceived to be at higher risk of bleeding.
Poche settimane fa a Dallas, in occasione del congresso nazionale dell'American Heart Association, è stato presentato in anteprima lo studio Engage, un trial di fase 3 che ha dato la definitiva conferma riguardo l'efficacia e la sicurezza dell'edoxaban, un nuovo farmaco anticoagulante orale che si aggiunge appunto a quelli già disponibili. Questo studio poi è stato pubblicato subito sul New England Journal of Medicine, la più importante rivista al mondo di medicina. Facciamo un punto su questo studio, sul suo significato, col professor Raffaele De Caterina, ordinario di malattie dell'apparato cardiovascolare all'Università di Chieti e uno degli sperimentatori dello studio Engage. Allora, professore, innanzitutto partirei dal farmaco. Che cos'è esattamente l'edoxaban?
L'edoxaban è un inibitore del fattore 10 attivato della coagulazione. I nuovi anticoagulanti.
The aim of the study is to evaluate whether initial heparin followed by ectobactam only is not inferior to initial heparin overlapping with warfarin, followed by warfarin only in the treatment of subjects with acute symptomatic venous thromboemboliums for the prevention of symptomatic recurrent venous thromboemboliums during a 12-month study period. Efficacy. Primary. Symptomatic current BTE, i.e. the composite of DVT, non-fatal PE, and fatal PE in the overall study period. Secondary. Symptomatic recurrent BTE in the on-treatment period in the DVT and PE separately, and insert PE with right ventricular dysfunction. Safety principle. Composite of measure of clinically relevant no major bleeding in the on-treatment period. All outcomes were adjusted by an independent clinical event committee. Statistics and analysis. Hypothesis. Endoxaban is non-inferior to LMW, heparin, warfarin for prevention of recurrent BTE. Estimated incidence of memory efficacy outcome with LMW, heparin, warfarin 3% at 12 months. Non-inferiority margin of 1.5 for hazard ratio corresponds to reaction of at least 70% of treatment effect of warfarin. Power 85%, two sides alpha of 0.05. Small sample size at least 7,1500. LMW, heparin ectoxacan regimen. Non-inferior to standard therapy for preventing recurrent BTE, consistent efficacy in patients with DVT and PE. Clinically significant reduction in recurrent BTE in right ventricular dysfunction subgroup. Less clinically relevant bleeding. Constant effect over central TTR qualities. Dose adaptations. 30 mg effective and safe. Attractive regimen for full spectrum of BTE patients. Reference. Last video.
Siamo a Bologna per il 19° congresso nazionale della FADO. Le terapie anticoagulanti orali, nuovi anticoagulanti sono stati al centro dell'attenzione, oltre ai tre che tutti conoscono, quindi da Bigatran a Pixaban e Rivaroxaban, se ne sta facendo un quarto di cui si è parlato anche qui al congresso di Bologna. E facciamo il punto su questo farmaco col dottor Di Pasquale, profondo conoscitore di questi farmaci. Cioè, dottor Di Pasquale, qual è il farmaco che arriverà un po' più avanti e che andrà quindi a completare la gamma di offerta di nuovi anticoagulanti orali?
Il quarto farmaco all'orizzonte per la profilassi tromboembolica fibrillazione atriale è l'edoxaban.